How does being locked up cause pain? Hey, Dr. Chris Schools here from Square One Health, and today I want to talk to you about one of the biggest causes of chronic joint and spine pain that we see, and that is a subluxation. Now, what the heck is a subluxation? Subluxation is a big fancy word that basically means that a joint is locked up, fixated, stuck, not moving like it's supposed to be. You see, all your joints have receptors on them that tell your body where they are in position and space and if they're moving properly. These are called mechano receptors. And you have three types of mechano receptors that send a positive signal to your brain when joints are in the proper alignment and they're moving properly. If you look at this model, you can see the joint should move. And if this moves, all these positive mechano receptors are firing, sending proprioception to your brain. And the part of your brain that detects motion is also the same part of your brain that controls stress hormones. Now, what happens when joints don't move? They're locked up, they're fixated, they're in the wrong position. When this happens, you have receptors called nociception. Big fancy word, all you have to think about is this is like a stress signal. But when nociception gets to the part of your brain where you're consciously aware of it, it triggers pain. Now, this is how this works. These mechano receptors, these positive signals, they actually kind of work like a rheostat. Now, if you're not from my generation, if you're younger, you may not know what a rheostat is. A rheostat is one of those lights where you can dim the intensity of light in a room, make it lighter or darker. And when you put motion into a joint, it dampens those stress signals and it shuts down pain. This is why when you have a joint that is injured, you naturally want to shake it off. You movement, you know innately to put motion into your joints. And there are things you should do every single day to get fixated joints moving properly and to keep them moving properly. But what do you do when your joints get so locked up you can't move them on your own? That's where chiropractic care comes in. See, chiropractic care is so good at decreasing pain because it restores normal motion back into your joints. And there's lots of different ways chiropractic adjustments can be done. One, you can have the traditional manual adjustments where people use their hands to get the joints to move properly. This is where you hear that traditional popping or cracking sound. Now, when you hear that cracking sound, it's not actually the bones or the joints that are cracking. What it is, it's gas bubbles releasing from the joints. You see, you have capsules around your joints. And when the joints move or they move properly, it releases these little air bubbles. That's called the cavitation. And it's the release of those little air bubbles that creates the sound. That's what happens when you pop or crack your knuckles. It's actually the joint moving and it's gas bubbles releasing and it's get that cracking sound. So it's not actually bones that are cracking, it's the releasing of gas bubbles from the joints moving. Which is why when patients ask me, Dr. Chris, is it okay that I crack my back on my own? First of all, I don't know what that means. That could be a lot of different things. And here's my answer. If you're forcefully doing something to get a joint to move, creating that cracking sound, that's probably not good because anything that has the potential to do good has the potential to do harm. But if you're doing normal stretches and mobility things like stretching your neck and you feel some popping or cracking, that's totally normal. That just means those joints are moving properly. Some patients even tell us after starting to see a chiropractor that their spine starts to crack more. What that means is where your joints used to be locked up and fixated, now they're starting to move properly. Totally okay, it's even a good thing.